and that will be sent out either later on this evening or early tomorrow morning. So keep an eye out for that. Also attached to that is a quick survey. We value your opinion as students and alumni here at WGU, so we're looking for that feedback. So if you could, it should take you no more than 2 minutes to fill that out. But then you also go back and reference the recording from today. This is one of our Career Quest sessions, which we are very excited about. Career Quest will be going on from now until the first week of February, so keep an eye out for other opportunities. If you haven't done so, definitely get registered for some of those opportunities where you can, just like this session, connect directly with those that might be recruiting for open opportunities or from specific organizations and companies. So take advantage of that opportunity. The chat is open. We will have a designated Q&A at the end. So I would encourage you to post those questions into the chat, and then what we can do is read those off. And then from here, what I'm going to do is I'm going to pass it over to our presenters, which I know a lot of you are excited for this session based off of some of the feedback. So Kelly, I will pass it over to you, and Rachel, the floor is yours. And it looks like you're
Sorry
muted.
about that.
There
I'm
it is.
muted, and I am going to get us going. So just bear with me 1 second. And I'm on the wrong slide, so let me transition back over to this. Okay. Are you seeing the correct slide at this point?
We're not seeing the one specific slide, just the main deck where it has like all the tabs, but it's not in present mode.
Oh, it's not? Okay, hold on 1 second. What about now?
Not yet.
Okay, hold on 1 second. I must be sharing the wrong thing. Are you seeing presenter mode?
Yes.
Yes.
Okay, let me try one more time. How about now?
Perfect.
Perfect.
Okay. All right, I apologize for that. Good afternoon officially. I think we're in the afternoon on the West Coast and a little bit later for people in other parts of the country. My name is Kelly DeBoer. I am the supervisor for physician and provider recruiters for Vision 21, which includes Northern California, all of Nevada, and then Pacific Islands. And I'm joined today by my colleague Rachel Relaford, who resides out of Hawaii, lucky her, and she supports the Pacific Islands provider recruitment. And today we're going to be talking about all things benefits, working at the VA, and then how to apply and kind of the ins and outs of that. We won't be going into a ton of detail, but we definitely will be providing you a good overview of those things that I just mentioned. And so we are available for one-on-ones if you'd like to meet at a later time. Rachel, do you have anything else?
No, just excited to be able to talk to you today. Good morning. It is still 10 a.m. here in Hawaii. Mahalo nui loa for joining us, and look forward to sharing with you some of the benefits and some of the, maybe even some of the tips and things that you might not know about working for the VA. So thank you, Kelly.
Thanks, Rachel. And just to give you a background, Rachel and I both came from the private sector of recruiting physicians, and I've been at the VA for a little over 5 years, and she's been at the VA a little over a year. Rachel?
I was in the private sector for 15 years and then joined the VA in August of 23.
Okay, perfect. So we can provide different perspectives during the Q&A if you have questions. So we'll go ahead and get started. And I'm going to have Rachel take over the top 10 reasons to work at the VA.
Yes. So this is a little bit more of a high level things for you to think about. Even some of the things that I didn't know when I first started considering moving, and when we call the private sector, working for, either a profit or a non-for-profit company, something outside of government, and even some details that when I considered making a move or a change in my career, the opportunities that were available to me that I might not have known of. But one thing I did know, I had a general high level understanding of the VA, but I did not realize that each year we serve over 9 million veterans. We have over 1,200 healthcare facilities across all 50 states, District of Columbia, and U.S. territories. So one of the things that I get to do that I'm really fortunate in my job is I support Pacific Islands, which includes Hawaii, Guam, and American Samoa. So a lot of times when we think about VA, we might not even be able to think about some of the far-ranging geographic areas that we cover. We cover Puerto Rico. There's other facilities as well. So just the expanse of what is the VA and the territory that we cover. We are a leader in clinical innovation and surgical quality. We perform over 600,000 surgical procedures annually. So if you think about that, pretty much unmatched when you sit and look at the private sector or many other employers. What you're able to be exposed to and the breadth of the work that we do is phenomenal. So just based on what I already shared, it's going to be no surprise that the VA is the leader in telehealth as well. So with technology changing and how we deliver healthcare, specifically, I'm going to talk about healthcare because it's the role that we're in. It used to be where you'd see that, a patient sees a physician or a provider, whether it be an APP, a PA, an NP, and you see that person face to face. But like so many other things with technology and the advancements that we've had, VA is also mirroring that. And so we are the leader in telehealth. We have over 2 million veterans accessing telehealth. The most recent statistics were about 4 years ago in 2021. So as you can imagine, especially after the pandemic, the way that things have changed, those numbers have already increased as well. That was most recent data that we had. We are, as I talked about, having a lot of innovation, the opportunity for cutting edge technology, but also want to highlight specifically for those that are looking to come in, the amount of educational support. I know I'll refer back to this often just because it was such a surprise to me when I came in, is the accessibility to be able to have support in order to continue your education or to have different types of loan repayment, tuition reimbursement, scholarships. We're going to get into a little bit more of that throughout our conversation today, but there are so many opportunities for that. I mean, the amount of loan repayment for those that are coming out that have student loans, or the accessibility to be able to apply for different types of programs that will help pay for either on the front end or on the back end, the education that you use to serve and care for our veterans, obviously, is really unmatched and something that I really try to focus on in all of my conversations and recognize the importance of that also. Employees, there's different types I talk about, like loans, loan repayment, scholarships. We also have something called public student loan forgiveness. Just going to highlight a couple of those right now because we're going to go into more detail. Some of them are shorter in duration, so you can serve as an employee for a minimum number of years and be able to have some of those loans and financial payments for your education paid for. And some are very, can be as longer in duration. And so that's really the opportunity for you to be able to have some flexibility so that you're not completely locked in throughout your entire career. And so you're able to choose the benefits that are most important to you in getting those loans repaid. One thing I also want to talk about a little bit is the opportunity, again, when you think about career advancement within your roles, a lot of times you're working for an employer that's geographically based in a certain area. And so your opportunities are really tied to that area. And so in order to be able to make a move or a change in your career, many times you're having to relocate. If you have family, if you're, have a partner, if you have children, it's not only that decision, but it's also the ability to make that decision for your family. A lot of times you're leaving a company where you may be vested in financially for retirement or other types of benefits. One of the great aspects of working for the VA is that your benefits and a lot of the things that you are incentivized to do are portable. So when you do make a change, if you're looking for career advancement, or let's say you have a partner that makes a move, or for family reasons you have to leave or change your geographic location, there's a great opportunity for doing that without leaving the benefits and without starting over with a new company, without worrying about losing, things like vacation time or, like I said, retirement type of benefits. And so, that might not be something that you're immediately thinking about, but where else can you go and literally be across the entire nation and be able to look at your career, not only in the trajectory of where it is today, but where it could be a year, 5 years, 10 years down the road. So that's a little bit about the living and working anywhere. And then lastly, just the amount of leadership training and opportunities that we have through the VA is, again, the opportunities for career advancement, the investment in employees in order to be able to advance in their careers. I know from my personal experience within my career, sometimes there were opportunities where there weren't career paths. We really didn't know, okay, if I come in at this role, what is my opportunity to be able to grow with a company or to be able to look at my career, again, 1 to 5 years down the road. One of the things that really does set it apart is that the transparency around that and what the opportunities are available. So those are just a few of the highlights that I wanted to cover to kind of start us and kick us off today.
Yeah, thanks, Rachel. And, we don't touch on this a lot in this slide, but one of the huge benefits of being one of the largest healthcare system in the nation is that we do offer details, so temporary transfers. So whether it's an emergency or whether we just need help with coverage. So for instance, during COVID, we sent like 5 nurses from the Bay Area to Nevada to assist with COVID when their nurses were sick. If, down in Los Angeles, if we have team members that are out, we can easily transfer physicians, clinicians, HR staff to help with whatever needs are at that particular location. So it really gives you an opportunity to kind of go serve, but also check out different parts of the country. And that was one of the benefits I didn't know about until I joined the VA, which is really exciting, especially if you are interested in traveling. We have a traveling nurse. We're not going to get into this as well, but we do have our own internal travel-based nursing program, which is great if you're in that field.
Go ahead and give a few more reasons. I know we've tried to highlight the top 10, but a few more things that we want you to be aware of that kind of questions that we get. One of them that we receive on a regular basis has to do with non-citizen hiring. Obviously, there are avenues and there are pathways. Many of our positions do need to consider those that have U.S. citizenship first, but there is a pathway to do that. And a lot of our more difficult to recruit or critical strategic hiring initiatives that we have, we do look at candidates that are not citizens. There's a pathway for doing that. We have members on our team that are completely dedicated to that process, that oversee every step of it. And in many areas where private employers may have a cap on what they're able to do for that, say a certain amount, a certain number of employees that they can do that with per different types of state guidelines. One thing wonderful about the VA is we don't have those caps. If we can make the justification and show the need and the ability and the necessity of hiring those that are non-citizens, we do not have a lot of those caps that are built in. So that creates a lot more flexibility in what we can do with our hiring process. A lot of those, especially that work in the medical community, have a lot of interest in medical education or not losing their most current or recent skills. So we have the largest medical education program in the country. We have over 7,000 training programs and partnerships with over 1,800 academic institutions. So a lot of those that we work with while they're in training, a lot of the different healthcare professions, they have to do rotations that are part of their training. And so they will come and do a rotation with the VA, and then that'll kind of spark their interest. They'll start asking questions about, oh, when I'm done, what would this look like for me? And so that's a great opportunity for us to be able to help highlight and show the work that we do every day, why it's important, why we want to care and serve for our veterans. That accessibility and being able to do that within training highlights that. And again, what's nice about it is it doesn't matter what system you're coming out of. A lot of times certain systems are more restrictive on where they're able to do rotations, things like that. Again, the accessibility of being able to have that exposure and see some of those opportunities. So even for those that are in training that may have an interest, looking at especially if they're clinical and they require some type of rotation, even in our outpatient facilities, what that would look like can be a great reason. I also know panel size. I'm going to kind of explain that a little bit further, but try to be brief about it. many times we look at, hours worked, quality of life, work-life balance, what you're being expected to do by your employer in terms of within an hour or within a day. The ability to be able to spend dedicated time focusing on your patients and truly providing quality care is huge. We don't have some of the same restrictions that you see a lot of times with large hospital systems or large healthcare providers, where they are solely based on productivity, and so they have to see so many patients. So many patients have to come through the door within a certain period of time. Our compensation is based, it's salaried. So whether you see, one patient or 3 patients within an hour, they're able to really focus on the needs of the patients, determine the complexity of the work that needs to be done. And looking at that, I think that sets it apart when you're really looking at providing quality of care and truly caring for the patient, and that being the priority. I touched a little bit on this, but I'll try to highlight it so we don't get too far down the road. But the transferability of benefits, and the fact that you can live and work anywhere within the country, make a move, make a change, and you're still going to be able to take those benefits with you, and you're not having to start all over or looking at how to transition those. Making a move is complicated enough as it is a lot of times, and so being able to do that a little bit more seamlessly is so important. Unlike a lot of our outside employment type of models, we do not have contracts. So there's not a situation where you are locked in for certain periods of time. You don't have the flexibility or ability to move. There's no non-competes. So if you're seeing patients, for example, and you're in healthcare and you want to do some what we call moonlighting, or go work in an urgent care, or go see patients on the weekend to supplement income, or to have additional opportunities when you're on vacation or things like that, there's no restrictions on that. Almost everyone you're going to see outside of the VA is going to have some type of restriction, or at least clauses that are built into their offers and their contracts that are going to provide some type of regulation on that. The ability and the flexibility, I think, is what I would highlight, is unmatched, is unparalleled. And then lastly, for this slide, just the ability to be able to practice with one state license. So a lot of times, with whether it be physicians, I'll use that as an example because that's the world that I work and live in every day. Some of the backlogs and delays in being able to practice, a lot of times states have much more, different types of restrictions. It can take a great period of time in order to be able to actually see the patients. You're waiting to get, all the necessary, we call it credentialed and privileged, in order to be able to see your patients. Because of the portability with working with the federal government, you can have a license in any state and be able to practice federally. So that cuts down a lot of the red tape in order to be able to get in and get started. I know a lot of times we get questions about that, specifically how long does it take and things like that. And that is one aspect of the process that really is nice. We don't have those same types of restrictions, and you're able to come in and kind of hit the ground running. And then lastly, talking about, again, we may cover a little bit more of this, again, different types of loan repayment and forgiveness, financial assistance during your education, either before or after, is something that cannot be matched. So many different types of programs that are available that you won't see, and as far as the breadth of those and the exposures, and having experts in all of those areas that will be able to connect you. Thanks, Kelly.
Thank you. Great. Now I'm going to touch a little bit on our benefits, which the VA has amazing benefits. We just have a few listed here, but we will provide links on this slide so you can go check out all the benefits depending on what type of employee you come in as. You are allotted, every employee gets 11 federal holidays. We have, depending on what leave group you come in, it's between 13 and 26 days of annual leave, and then 13 days of sick leave, which you can carry over year to year. So up to 55 days off, depending on what leave group you come in at, which is great work-life balance, as we talked about, we'll be talking about through this presentation. Health insurance, dental, vision, there are many plans to choose from. So when you are a new employee and you sign up, you don't just get allotted, one plan or a certain plan. There are numerous plans to choose from, depending on what fits the needs of you and your family. Federal retirement plans, we're in a 3-tiered system. So we have the government pension, we have our TSP, and then of course Social Security benefits with the 5% match. Like Rachel mentioned, when you are, if you transfer to another facility, all of that stuff is just transferred with you. You don't have to make any adjustments to your insurance, to your retirement plan. So all that's taken care of when you, if you're a transfer. Flexibility, Rachel and I both majority work from home, but there are lots of options. Even if you're a clinician, we do have work from home options. We have flexible scheduling. A lot of our HR staff will work a schedule where they get one day off a pay period, and we're on a biweekly pay period. We have 410 scheduling. Rachel had mentioned the one state license, which is amazing. And we just talked about not losing the benefits or the salary. Malpractice for our clinicians, that's paid for as well. And then I've included 2 links to our VA careers and also our total rewards brochure, which really outlines your total cash compensation with all these amazing benefits. So I would encourage you to check that out depending on what your occupation is. Learning opportunities, so student loan repayment, when you come on board with the VA, if you're, let's just say you're a nurse and they're offering education, student loan repayment for your occupational series, then you can get that money back after service, you fulfill that service agreement. They vary, so that could be 6 months, it could be a year. Internal opportunities, we have lots of great leadership programs. We also have probably the largest I've ever seen of online learning that you can just do at any time of day. We have that, and then we have our scholarships that up to $41,000 tax-free to help you pay for your tuition. I'm going to get a little bit more into EDRP, which is our Education Debt Reduction Program. So I've listed the 2024, some of them, not all of them. As you can see in the middle of this slide, psychologists, marriage, family therapists, critical care nurse, RN, mental health, med techs, nurse practitioner, mental health, social worker, rural sites. A lot of physicians are listed on there. So you could get up to $40,000 for a year of service, up to $200,000 depending on what your student loan, and the VA pays that directly to your loan fees. And it's a great program, and they do change every year, but sometimes if we have the need, let's just say during COVID, we needed ICU nurses. So we updated the list and added that so we could hire as many ICU nurses as possible. All right, and then this is just a sample of our total rewards for 2025. So I just went ahead and listed a $100,000 salary, and you can see here it outlines your healthcare, Medicare, life insurance, TSP, childcare subsidy, and the FERS with a total cash comp of $150,000. And then you can see here with your combined sick leave and your paid leave if taken. And your sick leave can roll over year to year, but we do max out on our leave for the year, which is encouraging you to take your leave. So our compensation, we have strong starting salary, steady growth, and incentives. Employee incentives are determined by a few different things depending on, you know, the need, the location, and we do offer relocation and retention bonuses depending on that particular occupation. We have regular performance-based increases and accelerated increases for outstanding performance. So, I mean, every year you'll see an increase, and we, most of all of the performance-based are achievable, and most of my employees all achieve those performance-based goals, which is great. We offer premium pay rates for overtime, weekend, holiday, and on-call and night work. So we don't touch on a lot on this slide, but so if you're a nurse and you're scheduled to work on a holiday, you're going to get that holiday pay, but you're also going to get additional days. So you're not going to just, if it's part of like the 11 federal, oops, sorry, I got a little feedback there. If it's part of the 11 federal holidays, you're going to get an additional day off, plus you're going to get that holiday pay. We pay overtime for 15 minutes past your tour of duty, so keep that in mind. We also do, comp time, so you can take leave versus getting paid out that pay. We offer incentive awards like Superior Performance Awards, Special Contribution Awards, Quality Step Increases, and VA Honor Awards. So the VA pay scale, a lot of times you'll see that GS pay scale, that's occupational specific, as well as the locality. So we'll provide those for you after this call. I'm happy to go into your particular occupation with you if you'd like to see what that looks like for the location you're looking at getting hired. And then VA Careers. So VA Careers is your starting point on how to apply for a job at the VA. I encourage you to go here versus USA Jobs because they have, it will filter by location and occupation directly to the VA. Plus it has the most up-to-date information on there. So we're gonna, you'll see here, this recommends that this job is open to, you might see that specific to the agency, or it might only be open to veterans. So that's going to be something you want to look at when you're applying for your job. Qualifications is often a rule out. So if you're looking at it and you know, you need to be a registered nurse, or if you are going to be graduating, it's usually at the time of selection. So you don't have to wait until you graduate to apply for jobs at the VA. That language is built into USA Job. That's often misconstrued. So I encourage all new grads, if you are looking, depending on the occupation, typically 6 months out, to start applying for those jobs and to get in front of those hiring managers, so that you, even if you will be taking that certification closer to when you graduate, it's at the time of appointment, so the time that you would start. Rachel, do you have anything to add to that?
I think that one thing, I think the kind of the point that I have, I think is going to be on our next slide, which really talks about the importance of sometimes the fact that if you don't know exactly when you're going to be looking, or you want to be a little bit more proactive, or you just want to keep an eye on things passively to look at what may be happening to get notification, I think this is probably, from the USA Jobs perspective, also something to keep in mind. So I think that, but from the VA Careers perspective, I agree with everything Kelly has shared.
So, and a couple things to note when you're applying for jobs, the jobs are all on East Coast time. So if you are applying for a job and it closes today, it will be closing at 9 p.m. Eastern time. So you want to get your job application in there. Our highly competitive jobs, especially our remote positions, they will often be capped at 50 or even less than that sometimes. So that's the importance of creating a profile in USA Jobs, is that you get those notifications, your resume, and all your documents are ready to go. Your veteran documents, if you're a veteran, all of that stuff is ready to go because those jobs will close quickly once they hit that cap. And oftentimes you'll see jobs that are only open for 3 days. So if you're traveling and a job opens up on a Friday afternoon, you'll want to get that, you want to have that saved to whether or not you can just quickly apply from your phone or from your computer and have that information ready to go. Anything else, Rachel? I think I covered. Pay close attention to the required documents. It is a screen out if you do not include the required documents in the job announcement. And as always, there is a contact information at the bottom of every announcement. If you have questions before you apply, please reach out to the person at the bottom of that contact.
I see a lot of questions coming in, people that have certain types of degrees that are completing certain types of education that may want a certain location. This is exactly what I would recommend because there are so many opportunities across the nation that's impossible for us to know every opportunity in every area, but that's exactly why we wanted to show you this feature today so that you can go in and actually say, okay, I'm seeking it in a certain geographic area. This is my background. You'll be able to look at the qualifications for the job, see if you match it. Or again, if you're more passive and you just want to be notified as new jobs open. So for those of you that are in, that are saying, okay, I'm looking for remote or I'm looking for something in my area, this would be exactly where we would direct you because you'd be getting the most up-to-date information because a lot of times this information is released. We may not even know about it because again, these, we're covering opportunities really across the nation. So everything from nursing to IT to healthcare to I see cybersecurity. I'm excited to see a really wide breadth of those that are participating in the call today. This is exactly what I would do is I would look at the VA careers page. I'd look at USA Jobs. I'd set up a profile so that way you can be notified immediately and there's no delay in it. So you can meet those tight timelines, especially if it's got a close date. And let's say you're on vacation, you're busy, you're working, you've got school and you may hit a certain time that, you're not looking at it consistently. It can be easy to miss. That way you're notified and okay, I can go in and I've got my CV, my resume already saved in there. I've got a cover letter that I can just sit and attach to the opportunity and send it out. Building that, what we call a profile in there is so important to do that. So I just really want to encourage you as you're looking at opportunities to consider that. It'll make your search a lot less, much more seamless as well, and it will take much less time. So that way, when you do identify opportunities of interest, you can apply quickly.
And I would encourage everyone to click on the button to make your resume searchable. The VA on the backside of USA Jobs has a search capability. So recruiters and hiring managers have the ability, if they're looking for a certain type of RN, they can go search resumes, and if it's one of the occupations that we can non-competitively hire, they can reach out to you directly. So make your resume searchable, and so that those hiring managers and recruiters can reach out to you. It's just a quick click button in your profile. Any other questions in the chat, or I just have a couple more slides?
I just wanted to address it. I know from those that were specifically asking about positions so that I kind of let them know that these are important slides to be able to include in that.
Awesome. Thanks, Rachel. And the next slide just covers a little bit of demographics about our workforce. So you can see here what that looks like. And there's a lot of the public thinks that we only hire veteran candidates. While that may be the case for certain occupations, for the large and mostly, it's not the case for most positions at the VA that everyone's eligible. It just, some positions are announced maybe internal only. We do have veteran specific, and then we have military spouses and transitioning military, but there are, in large number, there are a lot of positions open that are open to the public. And, you know, Rachel and I are both non-veterans that both got hired at the VA. So
I was just going to make the comment. I was going to say both of us. I actually had that perception as well to some extent. I thought, well, I don't have prior military service myself. I'm excited to serve our vets, but case in point of both of us being from the outside that we're able to be hired in.
very good. And lastly, I just want to read our mission. At the VA, we put veterans at the heart of everything we do. We recognize that it's up to all of us to make sure veterans can enjoy the health and happiness they deserve. That's why we're constantly pushing ourselves to develop more advanced treatments, enhance support services, and expand access to state-of-the-art facilities. I'll just share a quick personal note. I worked in healthcare for a long time before I joined the VA. It was a hospital that was very out of sight, out of mind in the city that I live in, with all the competing healthcare systems. I did get pinged on LinkedIn from someone asking if I would come down and have a conversation, and so I did. And from the moment I walked through the door, I just felt that I would be able to put meaningful work behind what I do each and every day. And I feel like that's our workforce of our employees. So it really is always back to the veteran. And to me, it's the greatest mission in healthcare.
Agreed.
So we will go ahead and answer any questions. And RJ, I will, are they just allowed to come off mute, or?
What I'll do is I will have them posted in the chat and then I'll read them off. So if you do have questions, I know there's been a bunch of questions thus far. I know Rachel addressed those, and I would encourage everyone a few things as far as when asking questions. Just remember, there's quite a bit of people in here. We don't want to make this about you, the individual. Obviously, you might have questions. Just keep in mind that, you know, there's a bunch of other people in here, so, you know, giving your full background, your experience, and then asking a question, we certainly would encourage you to connect with both Kelly and Rachel if you did have, you know, more in-depth questions. So keep it general, and so just keep that in mind. But if you could post those into the chat, I'll read those off. I know that there was a question specific, and I know a bunch of people had the same thing. You know, healthcare information management, is that something that I know you might not necessarily recruit for, but are those types of positions available? I know Rachel had said definitely check out the link, but there was quite a few people that were interested in that. So I was just wondering if that's something, any type of roles like that available with the VA.
We do. I will have to look up the specific occupation because it's not called that at the VA. I believe it might be called like medical records. It's not called HIMSS at the VA, but I can look that up, and I guess I can get it out to you, RJ, to follow up with the students.
That would be perfect.
We do, I see clinical research. There are lots of data scientists positions. There's clinical research roles. We are the VA is the largest teaching hospital in the country. So we are partnered with every major medical university. So there's lots of clinical, Rachel supports, she's supporting Palo Alto right now at Stanford, and that's a huge place for us that is doing a lot of those type of roles. And I would look for also those remote roles with that.
Perfect. Next question, as far as the tuition assistance, what is the yearly amount for that, if you knew that off the top of your head?
I think that was in our slides. Let me just double check.
It was. I'm going to go back and get the exact amount as well.
41,000 for scholarship opportunities. Yes. And then we also, for certain occupations, they do full tuition for employees. So I can't list off all of them, but for instance, for if you are a CNA, and you get the scholarship, they will basically pay for all of your tuition to go back to school, and you will get your salary while you work. So there are lots of, you'll see at the VA, there will be people that started as a CNA, got RN, got their nurse practitioner, and worked all the way up there from there.
Perfect. Next question, is it easy to pivot once you're in a position with the VA?
Absolutely. So the one, I'm thinking back to when I was in the private sector, and sometimes you have to wait a full year to, transfer when you're in a position. The VA, there's no waiting time. So if someone wanted to, if I wanted to go into a role, even after being in the new role for 3 months, I could put in for a transfer into that new role. So there's no waiting time. They also don't hold you back on transfers, which we have a policy. So it's typically 2 pay periods, or it's actually a pay period if it's a promotion, but typically the courtesy is 2 pay periods, which is about a month. But if it is a promotion, so if it's an HR promotion, we usually promote that person within those 2 weeks so they get that new pay. And it is very, once you're in the system, it's very easy to transfer. And we actually, on the physician side, are doing probably more transfers than we ever have, just because of the stability of the VA and the ease of it.
Awesome. Next question, what is usually the timeline once the job closes? So time to interview to an official offer.
Great question. So typically the managers have about 2 weeks to review the applications and then schedule their interviews. That's ideal. And then they usually have about 2 weeks to get those selections in. So by the time the job, because we always work from when the job closes, so they have 2 weeks to identify, who they're going to potentially interview, and then do those interviews. The process gets a little bit longer because we are now asking those managers to check all the references and get that package submitted back to HR. So I would say like a month and a half would probably be average. Of course, we'd like it to be sooner than that, but it really depends on how quickly we get, the references back and that package submitted back to HR. And then, so for instance, I made a selection in November, and my candidate is starting end of January. For physicians, that might be a little bit longer, or nurses, because they might have to be credentialed. So our time to hire for physicians is 100 days, and our time to hire for most other occupations is about 80 days. So that's the time frame we're shooting to bring you on from the point of selection. But we hire people, mostly physicians, but we do hire them like sometimes a year and a half out. So, but I would encourage you, if you're coming up for graduation, 2 to 3 months out, you should be applying for those jobs, and so you're getting ready for that application period.
Awesome. Next question that I have that I really like to throw out, especially for opportunities like this where you might see a large applicant pool, but how could individuals stand out during the application process?
I'll go first and I'll let Rachel go. So we didn't mention this, but we did include the links for your resume. We are the exact opposite of the private sector. You're going to want to be as detailed as possible. If it's not in your resume and it's in the job announcement that you have to do, that you are going to want to put whatever experience, volunteer, paid experience, you're going to want to list that out. the links, there is a federal resume that most staffing specialists at the VA are used to looking at. So I recommend that candidates really take the time to do a separate resume for the VA versus the private sector. The private sector wants you to do 1 to 2 page resumes. The VA would like you to do, sometimes they do have limits on certain positions, like no more than 10 pages. So keep that in mind, but they do want it to be very detailed. If it's not there, then they're not going to qualify you as having that experience, and they're going to disqualify you from that announcement. Make sure you always put your active license or on there, that information. If they don't see it, they're going to rule it out that you don't have it. We see that quite often. Rachel, do you have anything else to add?
2 things I did think of is, and I think you hit on this really well, one of them being having a separate resume for the VA and making sure you detail. Go to the actual position that you're applying for, look at the bullet points when it talks about what the qualifications are to it. Look at those and see, using that wording, how you can put that in your resume. If you truly do that, look at those action verbs that are actually in there. Like if it talks about you are facilitating or collaborating, or whatever action they're using within that, use that same terminology within your resume to help articulate the work and capture the work that you're doing. I would say, second of all, the other thing is, it is not, I actually do, a lot of people ask me the question, is it worth giving a cover letter? Does it make any difference? It does. I look at them when I receive them, I read them, my hiring leaders look at them, especially if you have a non-traditional pathway within your education. Let's say you took a break or you had a gap. Don't leave us wondering why. If there's something that you can detail in your cover letter that just shares a little bit, or that makes it so that we're not trying to decipher, well, I think this is what the resume is saying, but I'm not sure, did they just not work for, anything that you can help do. I do appreciate the cover letters that I get that help articulate, again, not just doing one to do one, but especially if you've got some specific things you want to call out, or something that you want to help explain that you think may be problematic or that we may not understand. I'm a big fan of cover letters. I do read them. I don't just discard them, and I do take the time, and so do my hiring leaders, because they want to know the why. Why is it? If you're applying for many different positions and they're getting a lot of applicants for these roles, what's going to differentiate or set you apart may be something that you say within that cover letter or that explanation. So I want to encourage you. I know it takes extra time, but if there's something specific, I still, even with physicians, I will get cover letters that explain, my dad served, and I grew up in a military family, even though I didn't serve. I grew up, and I remember hearing stories from my grandpa. I get that even from physicians in their cover letters. And I think that really creates a personal touch and approach that I appreciate, and helps me get to know them as an individual, not just a name on a piece of paper that's going to show me that they went to X school and they graduated on this year. So please take the time to do that. It's not a waste, and it is important.
Yeah, and
Awesome.
I saw the question about oh, sorry, go ahead.
No, go ahead.
Oh, I just want to address, it's not required that you do a federal resume, but it's recommended that you structure it in that way that they're used to looking at. So it's definitely not a required to have a federal resume.
And I will do a little self-plug here for those at WGU. If you are interested in learning more about how to write a federal resume, we do have a workshop coming up on the 22nd that I'm going to plug into the chat, and I would highly encourage you to attend that. If you're looking for pointers, some tips on how to properly write a federal resume, I will include that. So be sure to register for that. Another question that came in, relocation assistance. Is there any type of relocation assistance for individuals that might be moving across the country or into a different state?
Yeah, so you'll see that on the job announcement, it'll say relocation assistance available. So we have to have those approved prior to announcing that job. So if it says it on the announcement, whether it's recruitment or relocation, those are going to be pre-approved. So if it's not in the job announcement, they will not offer it.
Awesome.
Specific to that particular job. So
what I really like about it, if you compare, I feel like this is me coming from, again, the private sector. I think our job descriptions are transparent. They don't leave a lot of guesswork. You're going to know what your range is. You're going to know what's approved for that position. I think a lot of times you see different roles posted and you're like, you have no clue what they're very vague, or you're not knowing what you're potentially choosing. I like the fact that I believe there is a lot of transparency around our process. We're not here to keep secrets. There's no advantage to us doing that. There's not a code, an internal code where we're trying to keep it where you don't know. I like the fact that we are required to be transparent. You're going to know what the range is. You're going to know if it's approved for relocation. You're going to know if it's been approved for some type of loan repayment option. It's all right there in, if you look at it externally, it's all that information is right in there. So I think that adds, yes, there's some complexity, of course, to applying, but there is also some transparency that I think helps offset that a little bit, because some of those initial questions that other employers may not be able to put all that information out front, or they're more vague. I feel we give more on the front end than I see in comparison.
Next question, are there additional benefits for veteran employees that work at the VA?
Well, we didn't mention this, but the military buyback program, I can get that information over to you as well. We didn't want to spend too much time on that because we didn't know who was on the call. But trying to think off the top of my head if there was any additional specific stuff to veterans.
I was thinking the same thing about our military buyback. That's what immediately jumped out. And we have, again, what's nice is because we are a larger employer, we have people that specialize in that's what they do, that are able to help hone in on that. We can give like the high level details, but somebody that actually works in that, and there's different calculations and how they have to pull those numbers together, but are able to look at that and can help you make the determination of, being able to look at prior time served and like whether or not that's a financial advantage for you to be able to consider that. That's the one that immediately comes to mind. I'm trying to think if there's anything else just specifically for vets, but all of our other benefits, like like our general ones, like vacation or retirement, those are going to be the same across the board.
We can bring certain, depending on, years served, we can bring you in on a higher leave group, and depending on the occupation. But that's not, so we can bring in veterans on a higher leave group than we can certain employees. So
And that kind of leads into the next question. For individuals coming in, do you automatically start at the lowest pay, or is that negotiable? So if there is a pay range that's listed, is it automatically start at the lowest pay range, or is that something that, depending on maybe your experience, you might be able to leverage a higher salary within that pay range?
Yes, exactly. And that's what I would say, always putting your best foot forward on your resume from the beginning, because they're not going to come back and say, you're not going to come back and be like, oh, well, I have this experience, I need to get this amount of pay. They're going to take it from what you applied with. So always list that experience. But yes, so we didn't get into the GS pay scale, but I'll just use HR as an example. So we don't always bring in someone as a step one if they were coming from the private sector like Rachel. We can look at that and say, well, they brought this many years experience, so this is equal to the amount of experience they would have gained at the VA. So we might bring them in at a GS 12, step 5, just depending on the experience. So it does depend on the occupation and a lot of different other factors, but I would just encourage you all to make sure that you're putting your best resume from the beginning so they can look at that. And always be transparent with your hiring leaders about your pay from the get-go. Rachel mentioned this. We are transparent in everything that we do. There's no hidden secrets of what we are paying. You can see the ranges in there, and tell them what your expectations are.
Awesome. And I want to be respectful of both your times. So one additional question, and then after that, opportunity to maybe connect with the both of you. If there's a good way to, maybe have individuals connect with you if they do have additional questions. I don't know if that's over LinkedIn, if it's an email. Certainly want to get people connected. But you had mentioned the VA has a travel nurse program. Is this separate from the job listings in the Career Center, or are openings listed on that Career Center page?
I don't think they're listed on USA Jobs. Rachel, do you know? I think that's.
I don't think they are.
Yeah, I think they're listed internally. So it's for once you're in the VA, they have their own internal transfer, or excuse me.
Own internal, yes.
Travel, yeah. I was going to say transfer. Yeah, travel nurse program. Sorry about that.
Awesome. And then if people do have additional questions, like I said, what's the best way that they might be able to reach out and connect with either one of you?
I'm happy to put my email in the chat so we can schedule a time to meet. So I'll do that now so everyone has it. And if I don't know the answer, I'll get you to the right person.
Awesome. Well, I do want to thank you both, Kelly and Rachel, for jumping on, sharing these insights into the VA. I know individuals appreciate the transparency, as you had said, being upfront with this information. We certainly appreciate it here at WGU. Just a reminder to everyone, the session was recorded, so if you do want to go back and reference anything that was covered during the session, you'll get that recording either later on this evening or tomorrow morning. Also attached to that is a survey. We just ask that you take the time to fill that out. It should take you no more than 2 minutes. So we would certainly appreciate that. But again, thank you both, Kelly and Rachel, for jumping on and presenting to our populations. We really do appreciate it. So thank you both for providing the information. And what we'll do is we'll wrap up from there, but thank you everyone for joining us. Again, Rachel and Kelly, thank you for jumping on and sharing some great insights.
Thank you for having us.
Thank you. Have a great day.
Take care,
care.
everyone.